Hello, you all, and welcome back to Professor Truelove's Concepts for Nurses series. We'll continue to review the concept of problems with the brain. I am Professor Terry Truelove, and in this episode, we will be reviewing Parkinson's disease. Sources for this presentation are from Iggy's Medical Surgical Nursing 9th edition and Soul Introduction to Critical Care Nursing 7th edition. Parkinson's disease, also referred to as paralysis agitans, is a progressive neurodegenerative disease that it most often is idiopathic in origin. A neurotransmitter system of checks and balances allows for refined, coordinated movement through the balance of acetylcholine, or ACH, and dopamine. Acetylcholine-producing neurons transmit excitatory messages, and dopamine inhibits the function of neurons, so they act as an on and off switch. With Parkinson's disease, there is a malfunction in that balance. This results in a loss of nerve cells, decreased dopamine levels, an alternate ratio of dopamine to acetylcholine, and the exact causes of Parkinson's disease are not known. The symptoms of Parkinson's are consistent with the loss of these neurotransmitters. When dopamine levels are decreased, a person loses the ability to refine voluntary movement. The large number of excitatory ACH-secreting neurons remains active, creating an imbalance between excitatory and inhibitory neuronal activity. Parkinson's disease is a debilitating disease affecting motor ability and is characterized by four cardinal symptoms: tremor, rigidity, bradykinesia or akinesia, that is slow movement or no movement, and postural instability. Patients with Parkinson's disease can also develop emotional changes such as depression, irritability, pessimism, fear, and insecurity. A few patients have secondary Parkinson symptoms from conditions such as brain tumors and certain antipsychotic drugs. Primary Parkinson's disease often has a familial tendency. The disease is associated with deletion of mitochondrial DNA, and these deletions can cause a loss of neurons that produce dopamine in the substantia nigra. And although the exact cause is not known, it may be due to environmental and genetic factors. Exposure to pesticides, herbicides, industrial, chemical, and metals, as well as well water, an age over 40, and reduced estrogen levels are known risk factors. However, there are no differences amongst races or genders. Parkinson's is a progressively debilitating disease and is categorized by stages. In the early stages, there is one-sided symptoms, in other words, unilateral problems, and changes in posture, walking, and facial expressions can be noted. In the middle stage, the patient now has difficulty rising from a sitting position and maintains a flexed posture. In the late stage, the patient has an inability to stand or walk. This diagram differentiates some of the different findings about Parkinson's, including clinical features such as the head being bent forward, tremors of the head, a mask-like facial expression, drooling, rigidity of the muscles with a stooped posture, weight loss, tremor, akinesia, that is the absence or improper movement, loss of postural reflexes, bone demineralization, and a shuffling or propulsive gait. Management is through drug therapy, rehabilitation, client and family education, warm baths and massage to relax muscles, specific drug therapy, a bowel routine, self-help devices to maintain and meet ADLs, exercise to loosen joint structures, and range of motion exercises to prevent deformities. The diagnosis of Parkinson's disease is based on clinical findings after other disorders have been ruled out. Drug therapy decreases signs and symptoms and allows the patient to provide self-care and have a reasonable quality of life. You should monitor for drug toxicity when patients are taking medications for Parkinson's disease, especially levodopa combinations such as cinnamate. Drug toxicity may be evidenced by changes in cognition such as delirium, that is, acute confusion, or hallucinations and decreased effectiveness of the drug. Medications most likely to be used for the patient with Parkinson's disease includes cinnamate, anticholinergics, amantadine, and dopamine agonists. Other therapies for Parkinson's disease include surgery when drugs are not effective, and this may include stereotactic pallidotomy and thalamotomy. Newer surgical procedures such as deep brain stimulation and experimental stem cell therapies are becoming increasingly common and are newer options to control the symptoms of PD. Help patients and family identify community resources for chronic brain disorders, including the National Parkinson Foundation. To review, the nurse caring for the patient with Parkinson's disease includes safety measures such as promoting mobility, preventing falls, preserving independence, providing for exercise, passive or active, maintaining adequate nutrition, maintaining communication and communication support and assisting if needed, and of course, psychosocial support for the patient, their caregivers, and their family. That does conclude this podcast, but not the Neuro series. Stay tuned for further episodes, and we'll see you then.